there's still debate with laser therapy. And I do have to say, my osteosurgery cases, I know that when I go in there with the osteosurgery cases and address it, it's a quick fix. I know that I go in there, I can reduce the pockets, but it's so resective, it's so aggressive, and you know you're removing tissue and bone, and there's going to be long roots and sensitive roots, and the patients, before they even walk in my door, they've researched what they want to have done, and the patients overwhelmingly want to go through the LANAP procedure. They want to regrow tissue, regrow bone, regrow cementum, regrow attachment. They don't want anybody resecting, cutting their tissue away. So after years of having patients come to me and ask me if I was doing this protocol, I finally bought the laser. My patient response to the LANAP therapy has been overwhelmingly positive, and I've been a periodontist now for over 20 years. So I have my patients that have gone through osteosurgery, just traditional periodontal therapy. It's very painful. Then afterwards, I'm dealing with exposed roots and terrible sensitivity. And I mean, we have a whole protocol that we go through in my practice to decrease the sensitivity post-surgery, post-traditional surgery. Post-LANAP surgery, totally different experience for the patients. There's no pain. The sensitivity is, you get a little bit of recession, but the sensitivity is nowhere near as severe as with traditional periodontal therapy. So overwhelmingly positive results. So I'm just getting to my 6-month mark with a lot of patients, and so far the results have been very encouraging. And some of my cases, you have to understand, several of the cases are folks that have had surgery back 20 years ago, and they look at me with, "You're not touching me. I'm never going through that again." So I take some of these cases through, and their experience has been overwhelmingly positive, and the results so far are promising. Because there's so much research behind laser therapy now that there's no reason whatsoever why you should even be considering it. I think it's a great tool to have in your practice as another way to treat periodontal disease, and the patients love it.